In this video, we are going to see about humerus. Humerus is also known as funny bone and it is the longest bone in the upper limb. Upper end is related with shoulder joint, lower end is related with the elbow joint, and three nerves directly related to the bone. So this bone have many special features. You will see one by one. So whenever you are going to Viva, first you have to pick up the bone, then you have to identify the side. So this is a right side bone, so I kept in my right hand. If it is a left side bone, you have to keep in your left hand. So for side identification of humerus, the important thing you have to remember is the lesser tubercle. You have to identify the lesser tubercle and two small depression in the lower end. If these two things are placed anteriorly, then the side you can easily identify. Okay, now we will see the upper end. Usually they will ask about what are the features present in upper end and what are the features present in lower end. So humerus in the upper end have two important thing. One is lesser tubercle and another is greater tubercle. Followed by that it have neck. One is called anatomical neck and another is called surgical neck. And third neck also is there, that is known as morphological neck. Anatomical neck related with the attachment of capsule of shoulder joint. Surgical neck related with the axillary nerve and it is the commonest site for fracture in adult. So it is known as surgical neck. Morphological neck related to the growth of the bone where the metaphyseal end of the bone is present. Then if you came in between these two tubercle, greater and lesser tubercle, you will have a depression. This depression is known as intertubercular sulcus or bicipital groove. This is occupied by the long head of biceps. If you notice, if you place your hand and continue downward, the end of this bicipital groove will be continued downward as medial and lateral lip. Medial lip and lateral lip, and the center portion is known as floor. Each of them having some muscle attachment. Medial lip will give attachment to the teres major, lateral lip will give attachment to the pectoralis major, and floor for latissimus dorsi. And this greater tubercle and lesser tubercle give attachment to four muscles. These four muscles we call it as muscles of rotator cuff. So the lesser tubercle give attachment to subscapularis, greater tubercle give attachment to superior spinatus, inferior spinatus and teres minor in a up to downward arrangement. If you come down to the lower end, in the lower end you will see a projection. This projection is known as epicondyle, medial epicondyle. Then there is a flattened surface, that is a lateral epicondyle. This epicondyle have other name also. Medial epicondyle is known as common flexor origin. Lateral epicondyle is known as common extensor origin. This flexor origin give attachment to the flexor muscles of forearm. In pain in the medial epicondyle is known as golf elbow. You can remember as GM. G for golf, M for medial epicondyle. Then lateral epicondyle is known as tennis elbow. You can remember as TL. T for tennis elbow and L for lateral epicondyle. Then if you move downward, you will have a drum shaped structure. In posterior aspect, if you see, you can see it as like a clearly drum. In anterior aspect, it will be somewhat bigger. So this drum shaped structure is known as trochlear. Trochlear means pulley, and this portion is known as capitulum. So these two portion give attachment to the forearm bones, radius and ulna. So ulna will attach to the trochlear, radius will attach to the capitulum. And above this thing, anteriorly you will get two depression. So the depression above the trochlear is known as coronoid fossa. The depression above the capitulum is known as radial fossa. The depression present in the posterior aspect. Posterior aspect have only one depression, that is known as olligernar fossa. So if you see the ulna bone in the upper end will have two processes. This process is known as olligernar process. This is known as coronoid process. So this olligernar process will be attached here. So this process will occupy this fossa during the action of extension. During flexion, this fossa became empty, and during flexion, this ulna have another one projection. This projection is known as coronoid process. This coronoid process will occupy the coronoid process. So these are the important features in the upper and lower end. Then we move to the shaft. In the shaft, the medial and lateral epicondyle continuous upward as epicondylar line. Medial and lateral epicondylar line. This medial and lateral epicondylar line give attachment to medial and lateral muscular septum. Okay, it divides the flexor muscle and extensor muscle. Septum is nothing but thick and deep fascia. Okay, then if you see the shaft have three borders and three surfaces. The surfaces are anteromedial, anterolateral and posterior surface. The shaft of the humerus, if you see, upper 2/3 will be round and lower 1/3 will be triangular. Okay, and this change will takes place from the place where the insertion of the coracobrachialis muscle takes place. In humerus, another important thing they will ask, what are the changes taking place at the level of insertion of coracobrachialis? Coracobrachialis insert at the middle 1/3 of the shaft of the humerus in the medial aspect. So at the level of insertion, one thing is that the bone will become triangular, and the second thing is that the medial nerve and the brachial artery. The medial nerve will cross the brachial artery from lateral to medial aspect. Okay, this important thing they will ask. Then if you come to the shaft, in the shaft you will appreciate a V-shaped thickness. V-shaped thickness. This thickness will be present in the above the triangular portion of the shaft. This V-shaped thickness is known as deltoid tuberosity. It gives attachment to the deltoid muscle insertion. Below this you will appreciate a groove. That groove is known as radial groove, through which the radial nerve will passes. So mainly this shaft of the humerus have two important features. One is deltoid tuberosity and another is radial groove. And the shaft is divided into three surfaces: anteromedial and anterolateral and posterior surface. If you notice, a central line will be there. This line is known as the medial border and anterior border, medial border, posterior border. Okay, so this border only divide the surface into anteromedial and anterolateral surface. So from the shaft of this bone, one muscle called brachialis will be originate from the anteromedial and anterolateral surface. And another thing is that triceps muscle. Triceps muscles have medial and lateral head. That two head also originate from the shaft of the humerus. Three nerves are directly related to humerus. One is axillary nerve, it will be related in the cervical neck, and another is in the radial groove, the radial nerve. Radial groove is also known as spiral groove. Then in the medial aspect of medial epicondyle, posteriorly, the ulnar nerve. Because of this ulnar nerve, this bone get the name funny bone. So whenever you give pressure over it, you will get a electric shock like feeling. So that children used to play with their friends by giving pressure in the medial epicondyle. So that is known as so because of that it is known as funny bone. So these all are some of the important features they will ask in Viva. Thank you for watching.